Health Spotlight, presented by Community Health Network.
Infant mortality increased for African American families in Indiana for the second straight year.
News 8's Cody Fisher is digging into the reason why and the solutions leaders are planning at the 10th Labor of Love Infant Mortality Summit.
Hundreds of healthcare workers from around the state filled this ballroom downtown to learn about how they can improve infant mortality rates in their communities. This year's summit on infant mortality was branded Year of the Mom by State Health Commissioner Dr. Chris Box.
If you don't start with a healthy mom, it's very difficult to have a good outcome for the pregnancy.
Dr. Box says the state is working to create programs that reach women before they're pregnant. The idea is to educate them on contraception and their current health situations that could contribute to an unhealthy pregnancy.
If we have moms that are mired in substance use disorder, if we have moms that have diabetes that are out of control, it increases congenital birth defects for babies. It increases the risk of them being very small, being born preterm, or having to be born preterm.
In 2020 and 2021, Indiana saw an increase in infant mortality for African American families. Dr. Box says that's due in part because of the pandemic.
Many people were frightened to go to the hospital, to the labor and delivery unit, or even their healthcare office because they were worried they were going to get COVID from a sick person.
The Hoosier state also continued to see a gap in infant mortality rates between white Hoosiers and Latino Hoosiers.
It's very sad, to see that.
Reina Almanza is a Spanish translator for patients. She came to the summit to learn everything she can about the newest state programs so she can help close the gap in infant mortality in the Latino community.
Our goal is to be able to communicate, resources and make sure that they have the same knowledge that everybody else has. So we're constantly, bringing those messages to them, what resources are available, and making sure that they also have access to those same equal resources in their language and not just, in English, which a lot of them might not even speak.
Dr. Box says the programs in place to bring down infant mortality are working. They just need to be expanded statewide to reach the most vulnerable communities. One of those programs will be coming in the new year.
By May of 2023, we will have My Healthy Baby that's rolled out into every single county. So every woman covered by Medicaid, and that's over 50% of our deliveries now, if they desire to be connected to a family support provider or home visitor, they can have that opportunity.
Reporting in Indianapolis, Cody Fisher, Wish TV, wishtv.com, and follow us on Facebook.